Have you ever been in the trenches of making decisions around healthcare and therapy options for your parent or grandparent? I'm talking inpatient rehab, skilled nursing facilities, home health, outpatient. These can be very confusing and overwhelming if you haven't had to navigate this side of the healthcare system. In this video, we will discuss each of these settings so that you are equipped to better understand the continuum of care as it relates to skilled therapy services if you are faced with this situation again in the future. As an adult and geriatric physical therapist of 23 years, I've worked in all of these settings, and I've made countless referrals to the appropriate setting based on individual needs and patient circumstances. So let's just dive into a scenario that many people find themselves in, usually unprepared to make next step decisions, which is nobody's fault. It just speaks to the reality that it's not part of mainstream knowledge, and most people have to figure it out as they go, which can be confusing and overwhelming in the moment. A very common situation goes something like this. Betty Lou is a sweet 82-year-old female who is widowed and lives alone in the home she's been in for nearly 50 years. She manages pretty well in her home and walks inside without a walker, although she's unsteady at times, and she does use a rollator when she's out of her home. She still drives short distances to familiar places nearby when needed. Her 2 adult children lead very busy lives. Her daughter resides about 30 minutes from her, and her son lives out of state. Well, guess what? Betty Lou has a fall in her home. This is where most falls occur, by the way, and is unable to get herself up and call for help. After her daughter could not get a hold of her for hours, she drives over to Betty Lou's house, finds her in agony on the bathroom floor, and calls EMS. Unfortunately, Betty Lou fractured her hip and has underwent surgery and now is in the hospital recovering. Her son has flown in and her daughter has been at her bedside. Betty is getting a little bit of physical and occupational therapy, but she's very limited by pain, and she's really only been able to get from her bed to the bedside chair or bedside commode and back. I started my career as an acute care therapist. Shout out to Hillcrest Medical Center in Tulsa, Oklahoma. And I will always have a love for acute care. But as my teenagers would say, here are the deets. Acute care, physical, occupational, and speech therapy is an ancillary service in a hospital setting. Are they super important? Yes. Do they work crazy hard? Yes. But when someone is hospitalized, everything revolves around medical care first. The patients usually have lots of tests and procedures that they're being taken away for. And we have to be very diligent in checking vital signs to make sure they are safe and stable to work with. Things can change pretty quickly, especially in acute care. So therapists in the hospital work with the patients when they can, but they also spend a lot of time making recommendations to the interdisciplinary team on how this patient is doing, how they're progressing, and always looking towards making those recommendations for discharge planning. Back to Betty Lou. The PT really wants to try to progress to some substantial walking since Betty was able to walk prior to her fall. But right now, she's not really tolerating sitting up for long periods and is mostly bedbound. Given her age, some pre-existing chronic conditions, and new onset immobility, it is now discovered that Betty Lou has pneumonia. This, in addition to difficult pain management, further delay her progress in therapy, and now Betty Lou has developed a pressure ulcer or a bed sore on her buttocks. Nursing is tending to this problem. However, it is difficult to keep the pressure off of her tailbone given her current situation. The medical team says it's now time to start discharge planning because Betty Lou no longer has acute medical needs. This team would include physicians, the surgeon, the nurses, therapist, case managers, social worker, and any other specialist on the case. Betty Lou's son and daughter are pretty unfamiliar with what options there are for her and are quite honestly stressed about where she should go. They each have their own opinions, and this leads to some arguments between them. However, the one thing they agree on is that Betty Lou cannot go home alone. So what are the options? Every situation is different, but let's discuss post-acute therapy options for Betty Lou. Outpatient therapy. This is usually done in a clinic 2 to 3 days a week, and she would need to be in her home and have transportation to and from these appointments. She would also need to be able to tolerate more advanced moves and activities with the goal of reaching independence in the community. Option number 2, home health. Home health therapists come to your home or facility and under Medicare guidelines have quite limited time and duration. You can usually expect 1 to 2 days a week for a few months. The primary goal in home health is returning to independence or prior level of function within the home. Our third option is inpatient rehab. This is where the person is going to receive the most amount of therapy in this setting. And this is where the person will stay in as an inpatient in the rehab facility. They need to be able to tolerate 3 hours of therapy a day. Now, this comes with breaks. It doesn't mean it's 3 hours solid, but the goal here is to get the person, the patient, as optimally functioning as possible and to get back home. Our fourth option is a skilled nursing facility, or we say in the medical world, SNF. The reason someone would be referred to as SNF is typically because they have ongoing therapy needs and continued medical management of something, like, for instance, a wound or needing IV antibiotics that they can't receive in inpatient rehab or in the home, definitely not in outpatient clinic. Patients do participate in regular therapy here in the SNF. However, it is not as much as an inpatient rehab facility. Our fifth option, which is less common or talked about, is what we call LTAC, or long-term acute care. An LTAC is a good option for somebody who has more major medical needs and has exhausted their acute care stay, whether that was insurance dictated or otherwise. Similar to acute care, medical management is the focus here, but they do receive some therapy as well. So, given all of that information and thinking back to Betty Lou's circumstances, which setting do you think she should be referred to from the hospital? There is no right or wrong answer here, although there is a best answer. As we know, in real life, sometimes the best answer is not an option for various reasons, and we have to explore other paths to recovery. If you commented or thought to yourself SNF or skilled nursing facility, this is what I would have chosen and recommended for Betty Lou. The reason I would recommend SNF as a first option for her is because of the wound care needs, ongoing involved wound care needs, and she definitely needs therapy. However, I don't think at the point she was discharged from the hospital that she would be able to tolerate 3 hours of therapy a day. And so that is why I would have recommended a SNF. Now, there's a lot of other ways around this. Maybe insurance wasn't going to cover that for her. Maybe they couldn't find a facility with an open availability. So sometimes families have to kind of think outside the box. She could have maybe gone home with 24-hour private caregiving and had, home health and some other things come in to do the wound care, etc. But if I were the acute care therapist in this situation, I would recommend Betty Lou go to skilled nursing facility or SNF. Have you experienced a similar situation or had to figure out a plan B or C, please feel free to share in the comments as we can all learn from each other. Now, if this episode was helpful, I know you'll like this one. Thank you for joining me today. And if you found healthful connections here, please like, subscribe, and share with a friend or a loved one.